See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
If you can observe something and articulate a challenge or a problem that's really bugging you, you can help solve it.
The truth is that nurses understand inherently what needs to happen.
A hackathon is something that will change your life in ways that you couldn't ever imagine.
It's about the connections.
I mean, I can still close my eyes and feel that hackathon and hear it and picture it.
Welcome to See You Now. I'm Shauna Butler. In the race to improve health and health care, health innovation has a reputation as being more of a tortoise than a hare, taking years for a proven and safe solution to become widely adopted and available. But in the face of increasingly complex health issues and health systems groaning under the demands being placed on them, and a global pandemic, the need to pick up the pace, become more creative and inclusive, and make investments in innovation has become abundantly clear across the entire healthcare ecosystem. And several approaches to hasten the speed of problem discovery and solution building are being pursued. And hackathons may be the most exciting among them. Known for their high energy, fast-paced buzz, intensity, and specific focus, hackathons are competitive, team-based, design-like sprint events that were popularized by the software development community to collaboratively and swiftly create functioning software or hardware. The word hackathon is so commonly used in today's tech community that we've almost forgotten that it was coined around 20 years ago by mixing the two words hack and marathon, where hack is used in the sense of exploratory programming. While these events were originally geared towards the software community, in recent years, curious and daring clinicians, patients, and health tech innovators hijacked the concept and started producing health-focused hackathons. And hacking health has become a global movement that is exciting, rapidly evolving, attracting a broad range of hackers, and one where nurses are playing a lead role in driving them. In advance of the upcoming Nurse Hack for Health event, May 14 through 16, in this episode, we reveal the magic of hackathons through the voices and stories of health influencers, innovators, entrepreneurs, and first-time hackers who share how hackathons are transforming health, lives, and careers, and why being a part of a hackathon should be in your future. We begin our story by picking the highly trusted brain and broad-ranging experience of a health economist, health trend weaver, and author of Health Consuming, From Health Consumer to Health Citizen.
I'm Jane Sarashon-Kahn. I'm trained as a health economist. So what I do is I take an ecosystem view through a health economics lens and figure out how do we do healthcare better where patients are health citizens, where they own care, they're activated in their care. And that's really how we're going to save money at the end of the day in healthcare.
And not only are we going to save money, we're going to save lives. We're going to have better lives. We're going to have healthier lives. You have this rich history that I wanted to tap into to talk about hackathons from the standpoint of why were hackathons developed and what did those early hackathons look like?
My experience goes back to the guy who taught me a lot about big data early on, and his name is Fred Trotter. He co-wrote a book called Hacking Healthcare. Mm-hmm. And that's when I first started thinking about the H word, hack in a good way. The mischievous part of it is that we're mischievous together for a purpose. So we're doing positive things in the hackathon world. And in any case, that's when Health 2.0 had been convening for about 4 years then. Indu Subaya and Matthew Holt started the Health 2.0 conference, and he and Indu saw the future in terms of digital health in such a positive way. They're really good forces who helped bring us to this moment. They hosted hackathons very early in the hackathon world, in person hackathons, and people got together ahead of time. It was, old school hackathon. But why is that important? It brought people together from different backgrounds who were passionate at coming together for a very short period of time to solve a finite problem. And so what's beautiful about that is in healthcare doesn't change quickly. It's a slow-moving, evolving Darwinian thing. But the hackathon experience showed us if you carefully define a problem, know the guardrails around it, if you can ask the right questions, you can respond to it. And that's what we saw year after year, just at the Health 2.0 hackathons. And then we started to see them really grow in health. The more liquid our data could become, the more liberated our data could become. And so we saw a couple years later, Todd Park, the Obama administration, talk about data liberation. And that's when we started to think about open source, sharing data. And the real conundrum has been that EHRs have been so closed. So all that data is pretty locked up now, and we're trying to liberate it now, all these years later. So the hackathon movement tried to get to that problem. How do we liberate the data and use it for good to solve very specific problems? And then we saw nurses specifically coming together from different backgrounds, different geographies. So that's sort of my history with hackathons.
Yet, as Jane points out, then nurses got involved. You might wonder, because nurses are the quintessential hackers, especially when it comes to healthcare. Weren't nurses a part of hackathons from the beginning? Let's get the scoop on that from the accidental pioneer who was instrumental in bringing nurses and hackathons together, Rebecca Love.
My name's Rebecca Love. I'm the president of SONCIEL, the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. And really what I do is I convene nurses to drive forward the future of healthcare innovation by empowering them through innovation events to change the conversation around healthcare. Years ago, I was a struggling nurse entrepreneur, and a friend of mine said, Rebecca, you should attend a hackathon. And I didn't know what a hackathon was. And I showed up at this medical hackathon, and in the room was all the decision makers, the chief execs of the hospital, the physicians. And as I walked around the room, I realized there was no nurses there. And I thought for a moment, oh, this is where the decisions are made. I'm not supposed to be here as a nurse. But nobody asked me to leave, so I stayed for the weekend. And in the course of that one weekend, I learned more about the business of healthcare than I had learned an entire year of trying to start a healthcare business. I left there wanting to study the environment of medical hackathons. And as I did, there were a whole bunch of ones that had gone on. And what they told me is that very few nurses attended, but that a large portion of nurses were on the winning teams. So I thought, nurses must have the practical knowledge by which to create really great healthcare solutions. And that's where the idea came to me that there had to be a nurse hackathon.
What started for Rebecca as a curiosity and a research question has become a burgeoning global movement of nurse innovators, together with engineers and business executives, UX designers, gamers, tech enthusiasts, entrepreneurs, and so many others who come together to solve the real problems in healthcare. And the enthusiasm is as palpable as an inguinal hernia. Which brings us to the fall of 2019 in New Brunswick, New Jersey, at the headquarters of Johnson & Johnson. Pre-pandemic, back when hackathons were an in-person, maskless type of thing, it may have been cold, cold, cold outside, but things were heating up at the inaugural SONCIEL Nurse Hackathon.
I'm Brian Wyrick. I'm a chief nurse at Indiana University Health System, and I am here as a founder of a startup company to get these ideas to the forefront and get them into practice and become standard work. And this is really what I think it will take to make big improvements in healthcare. Just the energy from this weekend and what we're going to come out of kind of the hackathon today and the relationships that we're building. We're going to have a ton of great ideas. They're not all going to work. Some may fail miserably, but we have the right people here to go try those things.
We are in a prime time for nurses to really be change agents. Hi, I'm Antoinette Montalvo. I am a coach and mentor for nurses and a community health consultant. My big tagline as this visionary nurse is just daring nurses to be influentially visionary. Being able to know that whether you're at the bedside or the boardroom, in the community, or wherever you find yourself, you have an opportunity to truly not only leverage your setting, but improve how healthcare is delivered and ultimately change the landscape of health.
Among the many curious minds buzzing with ideas, problems to solve, concepts to be tested and developed, was an energy that could make your hair stand at attention. In attendance that year was nursing student Anthony Scarpone-Lambert and neonatal ICU nurse Jennifferre Mancillas. They didn't know it at the time, but this hackathon would change their lives considerably.
So I drove from Philadelphia with my university's director of innovation and another nursing student. And I remember how I was super excited to start the hackathon. I was a little nervous just because I didn't really know what to expect. I wasn't sure if it was going to be like, my team was going to be super into it, or if I was going to find a problem that I was really passionate about. It sounded like a dream for me, like a bunch of nurses and healthcare professionals interested in innovation coming together. That was like something that super intrigued me.
I had a red-eye flight to New Jersey, and I was in the very middle of the plane where the bathroom was, and the light kept on going off and on, and it was a really horrible experience. So by the time I got to the hotel, I was exceptionally tired, but I think it was all the adrenaline really and the excitement of, okay, what I'm going to experience, and being able to go through the day and really take it all in and learn as much as I could from the process. So it was all really thrilling, but definitely my trip there could have been improved. I was able to attend the hackathon because I'm a Johnson & Johnson Nursing Innovation Fellow. And so they were the one who sent us to this hackathon to really experience it, because I don't think that I would have flown 3,000 miles across the country to participate in a hackathon that I didn't even know what a hackathon was at that point. But I was excited to participate and kind of have that weekend and really take it all in.
How it was kind of structured is the first night, it was mostly just networking. There was dinner, and they brought in some guest speakers. And then basically they started accepting nominations for problem statements where nurses could go to the podium and share a problem that they were really passionate about. So I heard problems, anything from school nursing to, diversity in healthcare, to the social determinants of health, to the fact that hospitals have really terrible food. And a person wanting to kind of find a way to get better food in hospitals. Heard all of these problems. And one that really stood out to me was a nurse who had shared how during the night shift, nurses face unique challenges compared to the day shift that can impact patient care. And this just really sparked my interest, just because I never really thought about how unique the night shift is to healthcare. I'd worked during the night shift before. I had known, how it obviously was a different experience than day shift, but hadn't really thought of those unique challenges that were experienced. So was excited to kind of join that project idea. And yeah, that's kind of the first night of the experience, is networking, finding a problem to work on, and then the weekend began.
The energy level out of hackathon is just a whole bunch of anticipation, not really knowing what problems are going to be presented, and not knowing everybody's there, and just like this level of high energy, knowing that it's only going to last a weekend, right? You have a weekend to take it all in. And so it's really exhilarating just being in that environment. I remember not really realizing when I went into the situation that it was a competition in some sorts, and then having the dynamic change between, oh no, okay, now we're serious, and now we're going to really dive in deep and find a solution and create an MVP. And we did.
Indeed, they did. Taking first place at the inaugural Nurse Hackathon was Team Night Vision, who, influenced by tools used in the military, conceived an LED light device to enable patient care at night without waking patients with those overhead room lights. The goal of this wearable device is to limit disturbing patients while they're getting the much needed rest and to prevent other mistakes that could occur in the darkness, such as medication administration errors or reading orders incorrectly.
We created the Unite Light. It is a wearable LED light and made specifically for the healthcare setting. And we knew that we wanted to be intentional about how we did that. And we really took inspiration from our military nurses who, when they're out on the combat field providing care for their comrades, are not doing it with bright white light. They're doing it with colored LED lights because the wavelengths, they go less distance and they're able to see and not be seen. We chose red light because it is known to improve your night vision and helps you transition from light to dark to light environments, eat more easily, great for tactile things. We made a conscious effort to choose blue because blue is really great in being able to promote wakefulness. So the same reason they tell you to don't be on your phone before you go to bed, that blue light blocks melatonin production, which may not be great for patients, but is excellent for frontline healthcare workers who are working night shift and need to block that melatonin production and be really wakeful and alert and mindful when they're doing tasks in the dark and having to be in those situations for long periods of time. And then white light, because you need to be able to see things more specifically. So intentional about what colors we used and how we were going to use them, so that frontline healthcare workers could care for their patients in a manner that was going to reduce their sleep disruptions for their patients.
Jennifferre and I really loved working with each other, and I think we were really excited to start something together just because we were both really passionate about patient care and patient experience and really leveraging our nursing perspective to improve that from the front line. So it did take a while. It was a roller coaster post-hackathon, but ultimately Jennifferre and I decided we wanted to create Lumify Care with a mission that we were both really passionate about.
I think that there are nurses who really see the benefit of what we were able to bring to market and give as a form of support to them.
It's been so exciting to hear from nurses from all over the country, DMing us, emailing us, tweeting at us, just pouring in a lot of positive feedback. Although it's such a simple idea and product, I think it goes to show that innovation is not always creating something brand new or kind of creating this high-tech solution. Sometimes it's just putting the pieces together and finding the right end user that ultimately can still make such a large impact.
Anthony and Jennifferre met at the Saint-Ciel Nurse Hackathon in 2019, and they took inspiration from their hackathon experience, perspective as nurses, and interview data from over 250 nurses to found Lumify Care and build their first and flagship product, Unite Light.
I mean, I can still close my eyes and feel that hackathon and hear it and picture it. It was one of the most inspiring events that I've ever had the privilege of being a part of, and I've been a part of a lot of really great events. I'm Marian Leary. I'm a nurse and public health practitioner and the Director of Innovation at the University of Pennsylvania School of Nursing, and I'm one of the organizers for the Nurse Hack for Health. Just the energy, the community, the collaborations that were formed in that very short period of time. I mean, these are short weekend events, and the relationships and the energy last a lifetime. There are so many nurses and partners that we have and created at that event that have gone on now for, a year and a half. And nurses have created companies, so they really have long-lasting impacts. And that first Nurse Hackathon really started it all.
So I knew it was successful enough that we wanted to do it again. And so there were plans to do it again. And then pandemic hits. And that's what I'm curious, Marion, being part of the planning committee for the nurse. I mean, at that point in time, it was the Nurse Hackathon, and then it got changed to Nurse Hack for Health.
Right. And it changed to Nurse Hack for Health because it was a different focus. We really wanted to focus the hackathon on our colleagues who were at the bedside, out in the community, and really struggling with how to use resources and solve problems that they were seeing around the coronavirus pandemic. And so, of course, as nurse innovators and entrepreneurs who had done a very successful in-person hackathon in November, we thought, what better way to bring the power of nurses together to solve for the problems that they're seeing in their own practice, but to have them come together for a virtual nurse hackathon. And so that's sort of the reasoning behind the Nurse Hack for Health, was to give our community of nurses a space to be able to brainstorm and come up with these solutions that they really desperately needed at the beginning of the pandemic.
Okay, we know what we need to do. What model did you follow? Where did you look to? Had you ever seen a virtual hackathon done? I mean, what was the thinking and how was the team approaching it?
We were lucky enough that Sunsail has already been working with Johnson & Johnson. So they were already on board to do another nurse hackathon. And then we were able to partner with Molly McCarthy at Microsoft, and they came on as our technical partners as well. And to be able to use all of those different experiences and backgrounds to be able to create what has become the Nurse Hack for Health. And I want to also mention Microsoft's partner DevUp, a community partner organization of developers within Microsoft. And they've been a really big partner in this, helping us to coordinate not only the developers, but also the technical background of the platform. And so, of course, because we partnered with Microsoft, we've been using the Microsoft Teams platform for these virtual hackathons. And you asked if I had ever experienced a virtual hackathon before, and I actually had participated in a pandemic-related hackathon a few weeks before we started planning the Nurse Hack for Health hackathon. So I had a really good idea of what could be done and how to do it better.
What was the time frame on getting all of this done? I mean, it was ridiculously short.
Ridiculously short. I think we had a month. I think we pulled it all together in a month.
So a hackathon to create a hackathon.
Right. It was a hackathon to create a hackathon. Yep. It was a mad sprint to get this done, which was insane. I mean, there were a lot of hesitations because we had never done this before. Could we one, get the nurses to participate? Would we be able to create this sense of community, this sense of collaboration in a virtual environment for practitioners who were already working so hard and even at the beginning of the pandemic, burning out so quickly? Would we be able to get them onto a computer, onto a virtual platform for, an entire weekend to create solutions? Would we be able to recreate that energy and that community feeling that you get from in-person hackathons, which if you've never been to one, it's really hard to describe, but it is just this visceral feeling that you get of being in a space with people who are just like you, who are energized and creative and trying to really come together to help better health and healthcare. And would that be possible to recreate in this environment? We just didn't know, but we were willing to find out. It's been an incredible bonus during a terrible year. It turned out great. I mean, maybe it's like giving birth. I mean, I don't know. I didn't birth my child, but you don't sort of remember the pain afterwards. But I think it was tremendously successful. I mean, I've said it since then. I'll say it in the future. It went well beyond anything I could have expected from a unknown virtual collaboration and event. We had nurses from all over the world participating, which is one of the benefits of a virtual hackathon. We were able to get people who otherwise never would have been able to attend and participate. So you had nurses from, again, all over the world, different countries and continents and experiences, being able to hone in on a problem and come up with a solution in this virtual environment. You had engineers and designers and entrepreneurs and other folks able to participate as well, which at our first in-person Nurse Hack for Health, we didn't have so many of those people. And because of this virtual environment and because of the partnership with Microsoft and DevUp, we really were able to enhance the partnerships between nursing and engineering and design and things like that. And so that really enhanced the experience for the nurses and enhanced the solutions that we were able to create.
And one of the nurses who participated in that experience, the 2020 Virtual Nurse Hack for Health, was nurse executive Chris Recinos.
So I didn't even realize that they could happen in person, but it was a pretty fantastic experience being virtual, just to be honest. Hi, I'm Chris Recinos, and I am the CEO and founder of Nurse Leader Network. Prior to my role at the Nurse Leader Network, I was the chief nursing executive for Kaiser Permanente South Bay here in Los Angeles.
How did you find out about a hackathon?
Totally by accident. So I had found out about Sanciel and was like, and ended up hopping on a member meetup one night on Rebecca Love was there, and I believe you were there. And Rebecca was like, oh, by the way, we have a hackathon tomorrow. And I was like, what the heck is a hackathon? She was so full of energy. And I was like, well, she sold me regardless of what it is or it isn't. I am signing up for it. And guess what? I'm signing my husband up for it too, because the more the merrier.
Okay, so before you knew what a hackathon was, what was your image? What did you think a hackathon, what did you think it was going to be?
Well, so the first thing she said was, it's going to be fun and it's going to be hard work. Okay, fun and hard work. I'm down for both of those. And then she was like, oh, and by the way, you guys are going to be on different time zones and sometimes you work until crazy hours of the night. And I was like, okay, I need a babysitter. Check. The way that Rebecca described it and what kind of brought me into it was she talked about the journey that the nurses go on in terms of, you may not know exactly what it is you want to create, but you're going to be able to solve a problem that's been burning or lingering within you. And when you come out of that, you're going to have actually developed something like a minimally viable product, an MVP, that you can then bring into the world. And I was like, okay, first of all, there's no way you can do that in 3 days, but I'm up for the challenge.
So to set the stage, we've got people from all around the world, all the different time zones, all sorts of different backgrounds, and where they're meeting is on a computer using the platform Microsoft Teams. Microsoft Teams is the organizing tool that helps people to put their team together and a workspace for them to start working.
Yep.
Okay. All right. So now you've got your team. You know who's on that team. Now you need to start hacking. Is that what you? Okay. So what is hacking?
So that night I sat down and I was talking to my kids right after that 11 o'clock training. And I was like, I got to figure out a problem. I don't have a team or a group and I don't know what to create. And my 10-year-old son comes up to me and he's like, Mom, why don't you make an app? Because of course to him, the apps are his life. And I was like, what the heck kind of app? Like, first of all, I'm not an app developer, but second of all, like, why would I create an app? And my older daughter, my 19-year-old daughter was standing there and she was listening and she's like, well, what about an app for mental health and teens? And I was like, I don't know if I want to go there. Your sister has passed away from a mental health condition and I just don't know if I want to go there. And she's like, Mom, people need it. Like, you should just do it. And I was like, well, and then my husband was like, no, we're doing this. Like, we got to do this. There's a huge need. We need to do this. And so I wrote up a quick intro of, we are going to solve suicide prevention and mental health stigma in adolescents and kids. And so that's basically where it kind of started. And then when we got up at that 4 o'clock in the morning, we had, I think it was 3 or 4 other nurses that had signed up to say, I want to be a part of this. And they all had either teens in their lives, grandkids, sisters, brothers who had mental health struggles. Suicide is the number 2 cause of death in people the ages 10 to 24 years old. 1 in 3 people knows or has been a person who has attempted suicide in the United States. And if you look at kids between the grades of 9 and 12, 1 in 10 of those kids has thought about or attempted to take their life. 1 in 10 kids. Furthermore, prior to the pandemic, suicide rates were on the increase. And after the pandemic, in that age group, we saw a 65% increase in suicides. We said, okay, we know we have to do this for them. There's not an option anymore. Like, we are committed to solving this problem for them.
Yeah, it's every time I hear those numbers, I have to just catch my breath for just a minute. I think we all do. What's the solution that you guys are developing? How did you come up with it?
We realized that part of suicide prevention is really addressing the social isolation and normalizing the conversations around mental health so that we could receive care. And so what we found was that, for example, the kids were saying they didn't like apps that had ads in them. And so we knew that in the business canvas, as we created something that would be sustainable, that we would not want to rely on ads as a source of revenue. So we gave that to my husband, the MBA, to help us figure that piece out. And then my 10-year-old was like, well, I really need something that I can win. I want to play a game. And so we said, okay, we need to have elements of gamification in there. And then for the older teens and the adolescents, they were like, well, I really feel lonely. That was their biggest thing. I feel lonely. And so our motto then changed into like, why be alone when you can have a friend on your phone? And so we don't ever create a solution for an individual without that set of individuals. And that's what we did. We brought in the people that would be users of this to get quick feedback with mini focus groups to really understand, like, how can we make this most meaningful for them? And my daughter went and got on our Instagram and was like, hey guys, we're developing this app. This is what it does. And within an hour, she had over 100 kids reach out like, where's the app on the App Store? I can't find it. And we knew we were onto something.
So you were doing real-time user research to feed into how you were designing your solution. Is that right?
That's absolutely correct.
What was the next step after you had the user research?
So after we had the user research, we were like, dang, we're tired. We should probably have lunch. And that's what we did. We actually took a break and said, okay, we're going to have a lunch and we'll group back together in like an hour. And then we got back in an hour and we decided, okay, we really don't know where to go from here. And so we pinged on some mentors.
Oh, wait a minute. Mentors. So remember when we talked about all sorts of people participate in hackathons? Well, there are several categories of participants: organizers, coaches, judges, hackers, and mentors. Mentors are folks from a range of backgrounds who participate to provide technical support, subject matter expertise, business acumen, and experience. They aren't part of any team, but rather they're there to support teams who call on them with specific questions, who need advice or suggestions. They're kind of on call and they do rounds. And in general, they're just kind of these awesome hackathon ninjas delivering nuggets of expertise and skills. So back to Chris.
And so we tapped into them and said, hey, like, we know we want to do an app. We know nothing about app creation. Like, we just don't know where to go next. And the fellow from the chat box was like, listen, I have implemented and created a lot of different products with chat box. What do you guys think about having like conversations, right? Like, you're trying to normalize this, take away mental health stigma. You're trying to normalize these conversations. What about using a chat box like they would with the crisis text line, right? That's usually chat box that start to begin those conversations. And I was like, oh my God, this guy is Jesus. Like, he is exactly what we were looking for. And we were like, let's take it and run. So we sectioned it off and I said, okay, listen, we need somebody to look at artificial intelligence and how that can play into this language component of it. I had one person go out and look at, like, how do you create emojis and what does that look like? I had one figure out what type of platforms we could use to create like a gamification. But we each took our different piece and gave each other about 3 hours to work on it. And then we reconvened to see what we had. So everybody brought like a slide or two of what they had been working on, where they were at. And then I said, okay, now we need to get this on paper. Like, what would the app actually look like? And basically what Hello Harmony looks like is the user can go online and they design their friend. They pick the hair color, the eye color, the clothes that they wear. They pick their favorite pastimes. Do they like soccer? Do they like tacos? Like, what do they like? And based on those, they create this virtual friend who then chats with them back and forth. The gamification piece is that you have to work with your friend to achieve certain things, but there's going to be real life conversations in there where your friend's going to express vulnerability, or if you express vulnerability, there'll be some AI and some chatbot that will help navigate that for you. And so it really is a safe place where I can admit I'm not doing well, or I can admit that maybe I feel really sad about mom's divorce, or maybe I feel, really sad that I'm not seeing my friends because of the pandemic. And nobody really, quote unquote, can see it, right? It's not a real person. So you can be more vulnerable than if you thought that there was somebody behind the screen. You even get to design their feelings. So that person might be having a great day, or they might be having like a not so great day. And so it'll give the users the language to be able to have those conversations. It'll also help with some cognitive behavioral therapy, evidence-based techniques. And then there's a component where that if we recognize that this is an at-risk individual for harming themselves or others, it's going to trigger additional resources with a live human.
This is like 48 hours worth of work where you've gone from, I wasn't even sure what problem I was going to solve, to I know the problem, I've got a solution, and I've even thought about a business model. That's a lot to get done in a very short period of time. What was the result of the hackathon? And then what were the next steps after the hackathon?
It kind of felt like if you've ever, like when you graduated nursing school and you finally were like, oh my God, I'm done. Like I did it. And then you realize that you have the real work ahead of you. That's exactly how it felt. Like I felt so relieved, like, oh my gosh, I got it out there. And the reception was phenomenal. I mean, the feedback I got was great. There were so many people that reached out and were like, we need this now. Like I have a personal family member that really needs this. And we continue to get people reaching out to my daughter about where they could find the app. And so, I knew it needed to be done, and I started doing the work. The team has kind of separated a little bit, and I've folded in Hello Harmony into my business so that it's a component of what it is that I do with my business.
Earlier, you had no idea what a hackathon is. How would you describe what a hackathon is based on your experience?
A hackathon is something that will change your life in ways that you couldn't ever imagine. For those of you who have children and they always say like, you don't know until you actually have the child. That's what a hackathon is. You won't know until you actually experience it. Hackathon opened my eyes and provided so much meaning, more than I could ever even have imagined. And the fact of the matter is that in this pandemic, the burnout is real, the PTSD is real. Hackathons are really a way to provide resiliency. And so I think when we talk about hackathons, like they are truly transformational in terms of not just your professional development, not just having the prestige of being an innovator or an inventor or an entrepreneur, but it's transformational in terms of the way that you see the world. You get exposure to all of these different disciplines. You have a different level of teamwork. You are able to become very concise with your messaging. And these are all things that you can't pay for in school. Going to this is really going to transform your entire worldview and how you see the world and your place in it.
You've been the chief nursing officer for Kaiser Permanente. First of all, just being a CNO, being affiliated and working with a health system that is known for driving innovation, it might catch people by surprise to think, wow, Chris, at this stage of her career, leading that level, of course you already know these skills. And of course you're already an innovator. Maybe somebody at that level of responsibility and experience, maybe hackathon isn't the place for them. You want to respond to that?
First of all, hold my drink while I stop laughing. But number one, nurses are natural innovators. If there's an issue on the unit, the nurse is going to fix it, whether it's putting tape on a door so the door doesn't jam, whatever it is. But just because we're natural innovators, there's actually patterns to innovation. You can innovate all day long, but if you can't make it something that's sustainable and bring that product to market, it doesn't matter what your ideas or your innovations are. And so for any of those folks that think maybe a hackathon is beyond me, you're probably the one that I'm speaking to right now that needs to sign up, because that closed-mindedness is not going to get you very far. Anybody can participate, whether you have graduated elementary school or whether you are, in my case, have a PhD and have led a $60 billion budget, because there's always something new to learn. And because the networking there is invaluable. The people that I met at that hackathon, I'm telling you, this product would not be where it is right now had I not attended this. It probably never would have come to fruition, and it would have never saved the lives that it's going to go on to save. So you need to leave your title at the door with the hackathon and come in with open eyes, because you're going to learn something from it.
So hackathons, We've talked about all the great things that it can do. What are the things that you shouldn't have an expectation about a hackathon to produce?
It's not going to produce a motivated team. And what I mean by that is I shared with you how many hours I put into that. There was no guarantee that I was going to have a team of people that actually did their work. You got to bring your own motivation. You have to hold yourself accountable. You're not going to have a team leader hold your hand all the way. You need to be comfortable with being uncomfortable. You need to be comfortable with not having the answer, and you need to be responsible for your own self-motivation. The second thing that I would say a hackathon is something that is going to guarantee that you're going to have this beautiful baby that everybody's going to want to look at when you're done. Although it will teach you the process and it will hopefully end in something spectacular that you can then move forward with. It's not a guarantee. You also have to go in with the expectation of if you have an idea or ready for a product, your end result might not be that. And that's okay. So maybe you think you had a great idea, and then when you get to the hackathon, you really get clear on the problem you're trying to solve, and maybe your product just didn't fit that and it has to be modified, changed, or even thrown away completely. That's okay. That's completely okay.
Nurse Chris Recinos was the driving force of Team Hello Harmony at the 2020 Nurse Hack for Health. Currently in development, Hello Harmony is a mental health app focused on teens and suicide prevention. And Chris is the CEO and founder of Nurse Leader Network. So Chris's outcome is extraordinary, but not typical. Even for those hackers who don't leave with a new product to sell or a business to run. Is a hackathon meaningful? We asked Marian Leary. You said that there are lasting impacts.
Yeah, I mean, I think more than creating a company, like, yes, it's great if the nurses come out of this and create a company. But for me, that's not the ultimate impact. The ultimate impact is showing these nurses that they are innovators, they are creative, they have the solutions to the problems that they're seeing, and they have the power to create those solutions and take them forward. And they should be leading in this area. And I hear it all the time. Before these hackathons, the nurses really didn't understand that. And after the hackathons, they are empowered to do just that, to take their ideas to the next level, no matter what that means. It could be a business, but it could be scaling it up in their institution or in other ways. And really, that for me is the best part, is nurses now having a community of like-minded nurse innovators, but seeing themselves as the innovators that they absolutely are in health and healthcare.
For some final thoughts on the empowerment factor of hackathons and so much more, we return to health economist, industry advisor, and trend weaver, Jane Sarashon-Kahn. Jane, how do you see hackathons as tools of empowerment for people who didn't think that they were innovators?
Oh, goodness me. If you can observe something and articulate a challenge or a problem that's really bugging you, you can help solve it. And the beauty of the virtual world is you can put something out on a social network, in your professional network, and say, this is bothering me. Is it bothering any of you? And if so, let's come together and brainstorm on a Sunday afternoon for 2 hours or off shift at midnight. And the beauty of these social network hackathons is that you're collaborating with people all over the world and making new friends and learning from each other. And at the end of the day, you may well come up with an innovation.
So November 2020, we had a nurse hackathon that was focused on pandemic management. Never has there been a moment in time when people closest to the care, closest to the need and the urgency, has there been a moment when we needed their insights, problem finding, problem solving, and innovation. Yeah. So did that hackathon virtually and brought in hundreds of people from around the globe, which we were able to tap insights that we would have never been able to tap into. I think that might have been one of your first exposures to watching nurses in action innovate.
Absolutely. I mean, because I've been watching hackathons since, 2011, 2012. So roughly a decade before I had the pleasure of being part of the zeitgeist of that hackathon. 7, 8 months into the pandemic. And the power of the moment in the pandemic, many gifts are coming out, one of which is we're learning to virtually collaborate better. And the fact that you could bring people together from Finland and South Africa and New York City and working together as nurses, this global guild of professionals, it was a beautiful thing to witness, be part of, and pardon me, damn hard to judge. The margins on the outcomes, these concepts, the minimum viable concepts and the models were stunning. And it's because these folks are doing this day in, day out, and then took time out of their life that they did not have to do to be part of the moment. It was an amazing experience. And then the 3 stakeholder groups who supported this, SunCL, Microsoft, J&J, these are leaders in their own silos. And part of solving things is to break down the silos. So that was a message that was really important as well.
And I wanted to touch on your thoughts on what is the relationship of trust and innovation working together at this moment where we need so much data, we're asking people and patients to do things in different ways. Where is the opportunity for nurses to really leverage these trust dividends that they've earned?
This question of trust and innovation is profound. I don't know if you realize how deep that is in this moment, because without trust, there's no health engagement. And the number one form of health engagement right now in the COVID-19 crisis is vaccines and vaccination. So trust for health engagement. And Edelman, I worked with their team 10, 12 years ago on the first health engagement barometer. We asked people, what are the 3 factors that encourage you to engage in your health? Trust, authenticity, and satisfaction. Trust, authenticity. So is the voice authentic? And then satisfaction. Was it a satisfying encounter from sort of a consumer point of view? That's nurses, man. I trust him, her. He is authentic in that encounter. And yeah, I'm satisfied because I could take the time to say, ask my question and get an answer. So yeah, that has nurses all over it.
I think what we're seeing increasingly is those who are driving innovation recognize when you don't have nurses in your problem finding team and your solution building team, you oftentimes miss the problems that need to be solved. Jane, your work is so broad. There's not a sector that you don't touch, whether it's mobility, food, entertainment, education, all roads intersect in health.
Yep.
Have you got some thoughts about the process of innovation for health? Like, how does that process actually unfold? And where are nurses key and critical?
The root of the word innovation comes from the Latin innovare, which means to renew. So I've been thinking a lot about renewal in the wake of the pandemic and how do we innovate now? The patient voice has been missing. Dr. Safran testified to Congress years ago that patients are the most underutilized resource in the health system. But the more I think about nurses, I think nurses are untapped in this design/innovation process as well. Because if you can't talk to 1,000 patients, you can talk to 5 nurses who can scale the voice of the patient. Nurses are hands-on in the front line with the patient and the family. So access to the caregiver point of view is huge. They're so close to the situation. What I saw in the hackathon, these teams and tribes came together to solve very specific challenges and opportunities. And they could do that because they have these powers of observation that they then took in through their empathic filter so they could see the problem, the challenge, and humanize it to say, this is how Mrs. Jones or Mr. Smith had to deal with something that was really unnecessary, unpleasant, inefficient, or out and outright a patient safety issue, dangerous. So there are these levels of perception and observation, and then understanding, and then the ability to figure out the hack, the invention, but then the innovation is what happens when you put a model behind it. And nurses do that for that N of 1 patient every day times N patients. And then you figure out, how do we scale this? And then you can bring it to more than the N of 1 patient and family, and then it becomes the innovation. That's the user-centered design thing. That's that voice of the patient scaled through the nurse, is that the nurse is there, hearing the family issues, listening to the patient issues, observing the team, the clinical team, and then bringing all that to bear. So it's brilliant.
The next Nurse Hackathon, the next Nurse Hack for Health, it's going to be May 14th through 16th during National Nurses Month. You talked about having hackathons being very focused on a set of problems, and access to care has been a critical issue. And this hackathon, what do you think is the opportunity to marry what the moment needs, what health citizens are looking for, and what nurses are uniquely positioned to drive and innovate on?
What I've really been thinking about in terms of this health citizenship idea is, people want to own their health now. We know now that the home is the safe place for health. When we have a safe home, when we have broadband and connectivity, when we have room in the home, if we needed to distance from an elder and a younger in a multi-generational setting. So what can nurses do? Increasingly, people want care at home or closer to home, and not at the medical school, and not at necessarily in a hospital clinic. Maybe doctor's office closer to home, retail care, urgent care, at the Y, through my church, at the barber shop, in trusted touch points. So how powerful would it be to go and ally with a church on a Sunday where there's a potluck for lunch, where you could do a vaccination clinic in a trusted environment and work with the faith-based institution? The Y is such a trusted touch point in many communities, really important for kids and older people in a community, people of color, urban, rural, right? So I think nurses are part of this glue between this version 1 world of brick and mortar healthcare in an office, in a hospital setting, and at home, and then the continuum in between in different community touch points, and also virtual. Nurses have been part of the telehealth pivot too, and getting really savvy. Yeah. So there's this continuum of care enabled by technology, but the trust for that individual, with that individual nurse, can be leveraged across the continuum at the different touch points.
So there you have it, a brief and meaningful history of nurse hackathons and their transformational superpowers. Hard to believe that a weekend of intense problem solving by teams composed of newly made friends competing in person or virtually to create innovative prototypes produces so many enduring skills, insights, connections, confidence, and important concepts, products, and companies. It's baptism by adrenaline, conviction, design thinking, and competition. In listening to each story and their experience with hackathons, I was struck that none of them knew what a hackathon was before attending. But that didn't stop them. The benefits from a hackathon are available to people at any career stage, from student to early and mid-career to executives, to any type of problem, from a smallish pain point to one that is devastating and complex, and to any concept or product, from a wearable LED light to a better breast pump to a suicide prevention app. And their stories also capture just how critical it is to have organized support at the industry, institution, system, and professional level. And with that level of support and commitment, innovation and improvement are seeded, nurtured, and they flourish.
I think everyone's a winner at the hackathon. I really do, because I think everyone comes away with something different, a new connection, a new idea, a new level of empowerment for being a nurse innovator.
It's really empowering also to be in a space where everyone is like-minded.
So we need to harness those ideas and put that energy around real problems. There's nobody better than nurses to figure this out, and that's why we're here.
To be clear, it's unusual that participants emerge from a hackathon with a business partner and a product that leads to a company that secures funding and sales. But while the product results for Chris, Anthony, and Jennifferre are atypical, their experience results are very typical. Hackathons are remarkable for skill, network, and community building, identity shaping, and transforming lives and careers. With so many hackathons out there, focused on an incredible range of challenges, now is the ideal time to find the one that you're troubled by or in need of being solved, and jump in and hack on. Registration for the May 14 through 16 Nurse Hack for Health is live. Join us for an inspiring weekend of collaboration, networking, and problem solving aimed at developing solutions that can improve healthcare access and delivery. If you're excited about improving vaccine education and delivery, health equity, models and settings of care, medical deserts, and more, we invite you. No, we need you to innovate with us. And special thanks to the guests on this episode, health economist Jane Sarashon-Kahn and nurses Rebecca Love, Brian Wyrick, Antoinette Montalvo, Marion Leary, Anthony Scarpone-Lambert, Jennifferre Mancillas, and Chris Recinos. Each of them health innovators and health hack advocates. For See You Now, I'm Shauna Butler. Thanks for listening, and I'll see you at the Nurse Hack for Health.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.